Now let's complete our discussion of iterative value streams and how they can reduce diagnostic waste. In the last video, we diced or dissected out the iterative value stream and showed how experts use Bayes' theorem to strategically order tests and provide a cost-effective approach to arriving at the correct diagnosis. Now let's apply this approach to a little more challenging case. This is a 29-year-old homeless male presenting with a chief complaint of skin lesions for 7 months. 7 months prior to admission, he noted a large bluish raised skin lesion on his left thigh. 2 months before admission, he noted a similar lesion on his penis as well as on the sole of his left foot and subsequently in his left inguinal area. 1 month prior to admission, he began experiencing frontal headaches as well as right eye pain and blurring vision. He also complained of intermittent nausea and vomiting as well as diarrhea, 3 to 4 bowel movements per day for the past several months. He reported chills and fever to 38 degrees. He had lost 40 pounds over the last 6 months. Recently, he had noted difficulty concentrating. On physical exam, his temperature was 38 degrees. His pulse and blood pressure were normal. He was thin appearing, in no distress, alert and oriented. His lungs were clear. His heart revealed no heart murmurs, rubs, or gallops. On skin, there was a violaceous purplish red lesion on his left thigh. Additional lesions of similar appearance were appreciated on the sole of his left foot, left antecubital fossa, left groin area, and left mid-waist area. Laboratory data, his hemoglobin was 9.2, his white cell count was 4.3 with 76% PMNs and 17% lymphs. Platelets were 81,000, his albumin was 2.6. His chest x-ray showed multiple nodules throughout both lung fields, and his mediastinum was within normal limits. Here is the violaceous purple-red lesion on his thigh. This is his chest x-ray showing multiple nodular lesions throughout both lung fields. How would the beginner approach this case? The novice would create a very detailed problem list including all of his positive findings. Skin lesions times 7 months, chills and night sweats times 4 months, 40-pound weight loss, nausea and vomiting, diarrhea, frontal headache, right eye pain associated with blurry vision, decreased ability to concentrate, chest x-ray with multiple nodules, homeless, intravenous drug abuse. And would also order an equally large number of diagnostic tests, including skin biopsy, blood cultures, abdominal CT scan, upper endoscopy and colonoscopy, head CT scan, ophthalmology and neurology consultations, bronchoscopy, a PPD, and a toxic screen. The expert takes a very different approach. First, the expert creates a summary statement. In the process of creating this statement, she converts the history and findings from lay language into more abstract medical terminology. Examples might be weak equals plegia, no movement equals paresis, numbness and tingling equal paresthesias. The expert also uses forward thinking. That is, she thinks of possible diagnoses and reviews the key elements of their illness scripts. If some of those elements are missing, this encourages her to request additional history or to more carefully review one or more elements of the physical exam. After the summation statement is complete, the expert then applies pattern recognition to create a tiered differential diagnosis. How does the expert create an effective summation statement? She creates the shortest description of the patient's problem or problems. She prioritizes specific key components, and these components depend on the possible illnesses she is considering. The expert de-emphasizes less specific findings, such as race and socioeconomic status, that usually are not helpful. She also de-emphasizes non-specific complaints such as fatigue, loss of appetite. Prior diagnosis usually also is de-emphasized unless confirmed. The expert wants to start from scratch, using the raw data rather than accepting the conclusions of others. What are the key elements in this patient's illness script? Epidemiology: 29-year-old intravenous drug abuser, homeless. Time course: 7 months, persistent and progressive time course. Syndrome statement: bluish raised skin lesions beginning on his thigh, spreading to his arms, chest, and other regions of his legs, accompanied by intermittent fevers of 38 degrees and a 40-pound weight loss, and nodular lung lesions seen on chest x-ray. Past medical history: there was none. Here is the expert's illness script. This is a 29-year-old homeless male with a history of intravenous drug abuse who presents with chronic progressive bluish non-pruritic skin lesions on his legs, arms, and chest, accompanied by profound weight loss, intermittent fevers, and nodular lung lesions. The expert then creates a tiered diagnosis, breaking down the possibilities into Tier 1, high probability, Tier 2, intermediate probability, and Tier 3, low probability. For Tier 1, Kaposi sarcoma is chosen with an estimated pretest probability of 95%. Tier 2, cryptococcus or histoplasmosis, estimated pretest probability of 40%, and bacillary angiomatosis caused by Bartonella quintana with an estimated pretest probability of 30%. Although the skin lesions fit with this diagnosis, this infection is not generally associated with nodular lung lesions. And Tier 3 includes bacterial endocarditis, less than 10% probability, and non-Hodgkin's lymphoma, less than 10%. Based on this illness script, the expert creates a discrete problem list: intravenous drug abuse, chronic skin lesions, profound weight loss, nodular lung lesions, and fever. And this problem list encourages the ordering of HIV antibody and CD4 count, a skin biopsy, bronchoscopy, and blood cultures. The skin biopsy showed fusiform cells and small blood vessels, confirming the diagnosis of Kaposi sarcoma. This test only moved the pretest probability from 95% to nearly 100%, a small change, but encouraged the consultation of oncology to assist with the treatment, knowing the specific diagnosis allows the oncologist to tailor the proper chemotherapy for this patient. The HIV antibody was positive and his CD4 count was only 5, indicating that this homeless patient who used IV drugs had AIDS and was suffering from an AIDS-defining illness, Kaposi sarcoma. To review once more, experts use a targeted approach to diagnostic testing. They chunk by creating illness scripts and use forward thinking and pattern recognition. They create a tiered differential diagnosis to determine pretest probability and apply Bayes' theorem to guide testing. This approach can dramatically reduce waste, prevent misdiagnosis, and shorten the time from presentation to diagnosis and treatment. To become an expert takes time, 10,000 hours or approximately 10 years of clinical practice. It is very clear that we require more diagnostic experts. Our medical schools, PA schools, and nursing schools need to teach and encourage critical thinking. The shotgun approach to testing delays diagnosis and can cause patient harm. Remember Mary. The health and well-being of our patients hang in the balance. Thank you.